Medicare Part D is about to be completely transformed. The changes start in 2023, and by 2025 there will be a $2,000 cap on prescription costs. Coming up next, we'll show you a brief summary of the changes and how they will save you money. Andy Stamos here with Medicare Mindset. The Inflation Reduction Act was signed into law on August 16, 2022. This bill dramatically improves Medicare Part D over the next several years. So let's get into it. A quick note, this summary is how we understand the new Part D provisions at the current moment. We source this information from the bill itself and the Kaiser Family Foundation, both of which will be linked in the description. There could be additional information that comes to light that changes how the bill is implemented. If that happens, we'll provide an update. Alright, starting in 2023, we have good news for diabetics. Insulin copays will be limited to $35 for a 30-day supply for all insulins on the plan formulary and in all Part D and Medicare Advantage plans with Part D coverage. This expands on the insulin savings program that started in 2021, which only applied the $35 copay to certain insulins in certain Part D plans. This will also extend to insulin administered through an insulin pump, which goes through Medicare Part B. So that's good news all around. One additional change for 2023 will be no copays for vaccinations covered by Part D, such as the shingles vaccine. This is a nice improvement because the shingles vaccine is a bit pricey otherwise. In 2024, the fourth and final phase of Part D, Catastrophic, will no longer require a copay. Prior to 2024, you owe 5% in the Catastrophic phase, so this will save big money for those who normally reach the Catastrophic phase. What this means is there will indirectly be a cap on prescription drug costs in 2024 without actually saying it in the bill. According to the Kaiser Family Foundation, the cap will end up being about $3,250. That's roughly the amount of drug copays you would need to pay in 2024 to reach the Catastrophic phase, and then nothing after that. Next up is Extra Help or Low-Income Subsidy. This program reduces the cost of Part D medications for individuals who meet certain income and asset guidelines. Well, the eligibility to qualify is extended to folks with incomes up to 150% of the federal poverty level, an increase from the existing 135% threshold. And starting in 2024, Part D plan premiums cannot increase by more than 6% per year. This provision will be active through 2030. And finally, in 2025, probably the most exciting part, in my opinion, is the addition of a $2,000 cap on prescription drug costs. This applies to standalone Part D plans and Medicare Advantage plans with Part D coverage. Once you hit the $2,000 max, there will be no drug copays for the rest of the calendar year, assuming your medications are covered drugs on the plan's formulary. So once we're in 2025, choosing a Part D drug plan should be much easier for the folks with high-cost drugs. Now before we finish, a quick note about 2026 and beyond. Starting in 2026, Medicare will be able to negotiate the price of certain high-cost drugs. It's too far out to speculate which drugs will apply and whether this provision will truly deliver. So for now, we'll hope for the best and wait and see. If you have high drug costs under Medicare Part D, please hang in there. By 2024 and 2025, your out-of-pocket costs will be greatly reduced. Well, thanks for watching, and please check out our other videos linked on your screen.